The focus is on recovery, as you said, from these symptoms rather than just learning to live with them. Your brain is a prediction machine. If you're told that by someone who knows what they're talking about, then your brain will predict that it can never get quieter.
So it's such a point of frustration for me that we're not applying that same principle to tinnitus. Neuroscience is like here, and then clinical practice is like 10 years behind.
People would come back and say, my tinnitus is gone. My tinnitus was gone. And I woke up and it was gone. And I rang every family member. And I... all my friends, because I cannot remember, even as a child, not having this tinnitus. I've had it my whole life. I've been told my whole life it couldn't go away. And it's gone.
Hello, everyone. My name is Dr. Yonit Arthur. You are on The Steady Coach, and welcome to this conversation with Pippa Brond, MSc, who is both my friend and colleague. We are both audiologists and coaches, and we specialize in working with people who are dealing with neural circuit symptoms or medically unexplained chronic symptoms. While my channel primarily focuses on neural circuit dizziness symptoms, there are many of you out there who are suffering from tinnitus and hyperacusis, as well as other sound-related symptoms like misophonia and reactive tinnitus. Today, we're going to be talking about all of those sound-related symptoms and why recovery, not management, should be the goal of treatment. I think you'll get a lot out of this conversation, and if you'd like to learn more about how to recover from tinnitus, hyperacusis, and other sound-related symptoms, please take our free course. Yes, completely free. You will find it linked in the video description. It's comprehensive and uses exactly the tools that we use with our clients in practice. And if what we're saying makes sense to you, please be sure to hit the subscribe button. I release new content every week that will help guide you toward recovery from your symptoms, whichever ones you have. It is wonderful to have you back. Hello.
Hi, thank you.
Hi. Well, we have a task ahead of us today. Today, we're going to be talking about tinnitus and hyperacusis, and this is a long time coming. So obviously, for those of you who don't know Pippa, Pippa is an audiologist. She coaches. She is extremely skilled. And Pippa, this is why I'm introducing you and not letting you introduce yourself so that I can say what I want to say about you. She's extremely skilled at working with people with neural circuit dizziness. And she also works with people who are dealing with tinnitus and hyperacusis, both at the NHS in the UK and privately. And so today it's going to be sort of an interview, sort of a conversation. We're going to get into how to recover from tinnitus and hyperacusis. We're going to talk about why we're using the word recover rather than words that you may have heard before, like management. And to start us off, Pippa, I was wondering if you could share with us what's changed about the way that you work with tinnitus and hyperacusis since recovering yourself from vestibular migraine.
So, first off, the psychoeducation is very, very different, more in depth, more up to date with the current neuroscience, and less focus on distraction and on sound, and more focus on what got us into this high alert nervous system situation in the first place. And the focus is on recovery, as you said, from these symptoms rather than just learning to live with them. Because I used to say that people could get to the point where, particularly with tinnitus, the tinnitus would be there, but they didn't care that it was there, so it didn't matter that it was there. And I think as well, living through chronic symptoms myself, if somebody said that to me about dizziness, I'd be like, well, You don't know what you're talking about, do you? You try and live with this and act like everything's normal. Like, that's not gonna happen. And to be fair, some people were okay with that as an answer. And they're like, okay, I'll get to the point where it doesn't bother me, but it's still there. But other people, that make them very angry. And in retrospect, I can 100% see why it would make them very angry, because it's very, very different asking somebody to accept chronic symptoms for now versus accept them for life. And it feels completely different when you've got chronic symptoms and you feel you're never going to recover and you feel that this is the rest of your life. Actually, that's a huge element of the pain, not being able to see the way out of it adds this whole layer that can get quite dark, actually.
Dark, but based on the neuroscience that we have, seems to contribute directly to the symptoms sticking around.
Absolutely.
Yeah. So, like you, I was also educated to never promise things like recovery or cure. Oh, goodness gracious, no. I wasn't even allowed to say something like, we're here to reduce the actual sensation. The only words that I was taught to use for tinnitus and hyperacusis is, we're going to learn to manage them, or I'm going to help you learn to cope with them.
Yeah. Yeah.
And I seem to recall, I'm not going to name any specifics, but we've actually seen that even much more recently when you've looked into some courses, some educational courses for providers, teaching people how to work with people with tinnitus and hyperacusis. Aren't they still using that management-based language?
Yeah, certainly. I mean, CBT now is often recommended as the way for tinnitus, and it's in the NICE guidelines. And elements of it, of course, are really, really good. But I am aware of courses, strictly one of the things you have to do is tell people that they cannot recover, and the whole purpose of this therapy is to help you manage the sounds rather than any change in the loudness or, I mean, yeah, it's made very clear that it's not even going to get quieter. And of course, as we know, because your brain is a prediction machine, if you're told that by someone who knows what they're talking about, then your brain will predict that it can never get quieter. So then it won't. So then that's what they see at follow-up, of course, as well. So then that reinforces to them, okay, it can't go away because it never has.
That's right. And I seem to remember you telling me that when you started changing your talk track with patients, what did you start to see?
Follow-ups were so different. So different. People would come back and say, my tinnitus is gone. And even if it came back a bit later, it felt different when it came back later because they knew it could go away. So it didn't feel as scary. And then it would go away for longer and longer periods of time. I remember one person who said to me, I'd only seen her once. She came back at follow-up and she's like, oh my God, yesterday my tinnitus was gone. And I woke up and it was gone. And I rang every family member and all my friends, because I cannot remember, even as a child, not having this tinnitus. I've had it my whole life. I've been told my whole life it couldn't go away, and it's gone. And hers, it came, like I said, it wasn't just gone like that and gone forever. She had little periods of it, but when it came out, it was quieter. When it came back, she responded differently, and then longer and longer periods of silence. And hopefully now she won't hear it at all. But obviously I don't need to see her anymore because it was no longer an issue for her.
And you and I started seeing this, and that's why we made the course that we did. So this is the first time I'm mentioning it. I'm sure I'll mention it several times in this conversation. But we saw people continuing to get this message from very well-meaning providers who were simply following the guidelines that they learned when they were being educated about tinnitus. But those guidelines are behind modern neuroscience. Mm-hmm. So I'm wondering if you wouldn't mind just explaining briefly why we feel justified in using the word reduction of tinnitus or resolution or recovery rather than management.
I mean, for me, recovering from my dizziness just gave me pure faith that it could happen with tinnitus as well. But also, I mean, as audiologists, we do lots of hearing aid reassessments, and one of the list of questions that you ask everybody who comes for a hearing aid assessment or reassessment is, do you get any noises in your ears? Do you get any ringing or buzzing? And I started noticing that some people would say, oh, I used to, but I don't anymore. It's completely gone. I would be sat in a soundproof booth. I'm like, well, can you hear it now? Nope, completely gone. And some of them had new symptoms, so they'd forgotten about tinnitus. But this wouldn't happen if tinnitus couldn't go away.
Proof on the ground, right? So you yourself recovered from symptoms you were told were chronic and you just had to learn to live with. So that throws a giant wrench in this whole idea of what's possible. And then you started noticing over and over again, some people's tinnitus did seem to go away. And that also doesn't line up with this idea that it's generated by a nerve problem or by hair cell loss, and you're just kind of doomed because of central gain to have tinnitus after that. So could you, for people listening, we're not going to go heavy into the neuroscience today, but can you explain just a little bit about why that old way of thinking about it doesn't line up with what we understand? I know you mentioned predictive, a prediction machine, that our brains work as prediction machines. So could you help people understand why knowing that the brain is a prediction machine explains why tinnitus can actually go away?
So I think that we can get this impression that we have the sensory information coming in, and then we get this objective view of the world. But the new neuroscience shows that that is not the case. So the brain has a set of expectations which speeds everything up, and then it compares the sensory information coming in to these predictions, and we're only really aware if there's a massive difference between the two, because our brain just uses these predictions to make everything go by faster and efficiently. And visual illusions are a really good example of that. So there are lots, if you look online, there are lots of beautiful visual illusions where it looks like one thing's happening because your brain's predicting one thing's happening, but then actually if you change the contextual cues, it looks completely different, because it's not just about the sensory information coming into your eyes. And if you wear prism glasses that turn the world upside down, after a few days, your brain adjusts and turns the whole world the right way up again. It's insane. You must have some good examples of that too, right? You talk about it all the time.
I do talk about it all the time, but I'm enthralled by your examples because they're so applicable. There's this black trash bin that sits next to my desk, and I have a dog whose fur is black. And so sometimes I'll see out of the corner of my eye and I'll say, oh my gosh, why is my dog over there next to the desk? But then when I look, it's a trash can. My brain is using contextual information to draw the conclusion that this is my dog over next to my desk. But so when I actually look at it, it turns out it's not. But my brain predicted that it was my dog when it was really a trash can.
Yeah. Yeah. And I guess you've got an emotional attachment to dogs as well.
Yes.
And that will affect the predictions our brain makes. So like if you're walking through a forest full of sticks, you wouldn't even notice the sticks unless someone told you the forest was full of snakes. And then you would notice every little stick, and you might even make a mistake and think that some of them were snakes.
Absolutely. And there are some other things that could potentially make you look for snakes. Maybe you're just generally afraid of snakes. Mm-hmm. You're more likely to start seeing snakes where there are no snakes. And also, if, say, you're dealing with a lot of stress in your life and you're just kind of on high alert about everything, even if you're not specifically afraid of snakes, you could go into woods with snake-like sticks and potentially see snakes there too.
Absolutely. Yeah, because you believe the world's like a really dangerous place and expect and predict danger to just be everywhere.
Yes. Okay. So now that we're edging into the contribution of danger here in this perception, can you explain how that plays into whether you perceive tinnitus or whether you perceive sounds as too loud?
So I see chronic tinnitus and sound sensitivity as when the brain is associating the sound with danger, and then it amplifies that sound in order to protect you from the perceived threat. So it's trying to help, but then can cause a lot of distress.
So what you're saying is, sort of like in the example with seeing sticks as snakes, your brain's trying to alert you that there could be danger so you could potentially take action and get away from it or fight it off. So it starts to see an internally generated sound or nerve signals as potentially snakes or some source of threat, and then it keeps drawing your attention to it. Okay.
Over and over, and also turns the volume up on it and makes it louder. And then how we respond to the sound when that happens can drive it up even more, because the fear response essentially to the sound or frustration reinforce even more that this is a threat, and then make it even louder again.
Right. Okay. So this is where the pieces are going to start to fall into place, folks, if you're listening. So we're going to talk about this danger contribution in a bit. But I first want to bring us back to what we were talking about when we first started. How both of us have learned over the years with experience and with personal experience, in your case, in my case, just with clients who are experiencing these symptoms, that this management focused approach is short-sighted and inadequate and sells short what people are actually able to achieve. So I'm wondering if you have thoughts on why so many audiologists and other healthcare professionals, although obviously very well-meaning, persist in using this management-based model for tinnitus and hyperacusis.
So, I mean, some of us trained before this new neuroscience was available, right?
Right. Absolutely. So some of it's just lack of knowledge, is what you're saying.
Yeah. So some of it is that obviously people are trying to help. I think, I mean, it seems like there is no cure. It's just a rote line that gets passed on and on and on. And even some neuroscientists who know about the predictive coding, who talk about it all, who talk about the threat response in tinnitus, they still seem to think that in order for them to be able to say that you can recover from this, there needs to be some kind of pill to get rid of it. Like, we're very, very medicalized in our society. And so they are still saying that there is no cure, even when they do understand that. I mean, it doesn't seem like a big leap to go from the nervous system's in high alert, the brain's in high alert, to, well, if we calm it down, the tinnitus could go away.
It's not a big leap. It's not. And it's just what we pointed out. If you're in the woods with sticks, you could potentially think they're snakes if you're on high alert. If I'm on high alert and I'm worried that my dog might be eating my desk, because he has done that, I might see my dog out of the corner of my eye rather than my innocent trash can that's not eating my desk. So humorous examples, but we all have experiences every day that show that this actually happens. So it's such a point of curiosity and obviously frustration for me that we're not applying that same principle to tinnitus. It's almost like, I said this earlier, it's like neuroscience is like here, and then clinical practice is like 10 years behind or something.
Yeah.
And it's just taking time for it to be translated into clinical practice.
It is. I think, to be fair, that it is well known that there is a psychosocial element to tinnitus. Like, really well known.
Psychosocial meaning, just for people who don't understand that term?
What's going on in their life, essentially, and the fight or flight system. And so,
stress.
Stress. I don't like using that word because it can be misinterpreted, and people can then say, oh, well, I'm not stressed, so this doesn't apply to me, which is where I was on all of this to start with. So sometimes we have to reassess what stress means, and how it shows up, and that it isn't always obvious, because it can be what's going on inside, well, not what's going on outside. And sometimes that is not feeling anything that's going on outside. So you can think that you're handling things amazingly because I have people who come in and say, well, I've just been through cancer and I handled it really well. I didn't even cry. And you can see how on one hand that got them through. On the other hand, they're clearly not feeling everything that's coming along with that, and that has consequences.
So what you're pointing at, I'm sorry to interrupt you, but this just seems really important. So I have observed, and you're pointing out, that many professionals do know there's a stress. I'm using the word stress, understanding that that's not your favorite word.
Yes.
They understand there's a stress connection. So they'll give people these checklists of questionnaires, right? Or checklists or questionnaires saying something like, oh, did these stressful things happen to you? Right? Or like, are you feeling depressed, or are you feeling anxious?
Yes, they will do that. Yeah.
And these don't necessarily capture the kind of thing that could lead to this danger response that we keep talking about in response to tinnitus or to sound sensitivity. Is that what you're saying?
That is exactly what I'm saying. And I'm also saying that a lot of them are actually using stress reduction techniques with people as well. Yes. Breathing exercises, they are reframing thoughts. They're using psychological models. But unfortunately, if they miss out the piece of the tinnitus can go away, then it still doesn't go away.
That's exactly right. So even if they're doing a good job at addressing this psychosocial component or the stress, if the message is simply you're going to manage this and cope with this, we're setting the bar low. We're not giving people the option, really. We're telling the brain, continue to predict the sound, because I, the person in the white coat with the expertise, say this is all you can do.
Yeah.
It's a nocebo.
It is a nocebo. Absolutely, it is a nocebo. And also, just to add, when we're saying you can recover from tinnitus, we also mean you can recover from other forms of sound sensitivity like hyperacusis, misophonia, even pain hyperacusis. So I just feel the need to point that out as well.
Thank you for mentioning that. And I'll just reiterate, we're talking a lot about tinnitus, but all of these other sound symptoms, although of course they may be very different in experience from what someone might experience with just tinnitus, they are the result of the same predictive process, the same danger appraisal or assessment process that the brain is using to crank up the sound so that you hear it, or to make the pain happen so that you feel it and know that there's danger. It applies to all of these sensations and all of these experiences.
Yeah.
Yeah. And we do address that directly in the course as well. We have some exercises specifically for hyperacusis and misophonia, as well as those directly for tinnitus. So for those of you with sensations that aren't tinnitus, or if you have tinnitus and other sound sensations, the course has some things specifically for you. Yeah. Okay. So I'm wondering if you have any thoughts on, okay, everything we said, I think makes sense. What I wonder, do you think there are any other contributors to the reluctance that audiologists and other healthcare professionals feel in continuing to persist in saying this management coping thing is the only thing people can do? I mean, you mentioned this is the way they're trained. You mentioned, they're not necessarily thinking about stress kind of in the more holistic way. They're not necessarily aware of the nocebo effect. I'm wondering if you think there are any other contributors.
I mean, there is the whole you're giving people false hope.
That's what I was hoping you were going to talk about. Yeah. And you've personally been under fire for that, haven't you?
We won't go into that.
You've been accused.
But I have accused of, I've been accused of giving people false hope. But I mean, I've seen so many people recover from this that just seen so many people recover from this.
You're asking people to deny what you're actually seeing with your own eyes in real patients over and over and over and over again.
Exactly.
And until you try and see what happens, you don't know if it's possible. And we're not the only crazy people either. We're not the only crazy audiologists doing this either. We have colleagues at Freudert in Wisconsin who are doing the same thing and seeing the same kinds of results. They're seeing people have their symptoms actually go away, or significantly reduce at least, because they're not giving them that same management line anymore.
Exactly. Yeah. And actually, so often when I'm discharging people, it's at the point where the tinnitus is there sometimes, but it doesn't bother them when it's there, and when it's there, it's quieter. But I have seen people where it's completely gone for long periods of time. And I even saw someone who, I mean, people might be aware of this, but as audiologists, we do routine hearing tests for ear, nose, and throat, right? So they're not actually coming to see us. They're going to see ear, nose, and throat for a follow-up
for whatever reason.
Whatever reason, something to do with the nose, whatever. And we give them a hearing test. And once I was on an ENT clinic, and I saw someone who I'd seen for quite a while for tinnitus, because he had a lot of problems with tinnitus. And then I discharged him because he was doing great. And he happened to come to me for a hearing test. I was like, oh, how's the tinnitus going? And he said, oh, I forgot I had that. Like, he came to see me. But he said he forgot that it was really a thing. Like, obviously he remembered. It used to be a big deal. But it's like, I can't believe it. I used to spend hours thinking I'll never hear silence again. And I've just realised that actually a couple of weeks ago I went on holiday to this cabin in the middle of nowhere. And I just remember thinking, wow, it's so silent. Isn't that amazing? And the thought of tinnitus didn't even enter his head. And then we were sat in a soundproof booth. I was like, well, can you hear it now? No.
Wow. That must help a lot when I know you and I take the same kind of heat sometimes for giving false hope or making, bold statements like people can actually get better from their symptoms. But when you just see it happen over and over again like that, that's a perfect example. I mean, you're seeing it right before your eyes. What are you supposed to do with that other than to start saying, okay, there's something about the way that I'm treating these patients that's different. And that works. That is working to get rid of the sensations they're having. This reminds
so
me,
just to clarify as well, just to say, lots and lots of people I will see at follow-ups and they'll say, I've had a few weeks with no tinnitus, like lots of them.
Yes, because you're a magician. So just so everyone knows, you are highly skilled and also incredibly courageous and a pioneer. So that's why, because you're willing to do this when other people aren't. So just, you don't have to respond to that. I'm just saying that's why.
Back at you.
Yeah. We're here patting ourselves on the back, everyone. But it's only because
you put yourself out there more than I do. Like.
Well, we take heat. We take heat. So once in a while, we got to pat ourselves on the back. Okay, so the hearing test story, which is such a beautiful story, and I love that you've seen this over and over again, raises a question for me that I think people are going to want an answer to. So many people with tinnitus, hyperacusis, and other sound-related sensations have been told that the reason they have their sensations is because they have nerve damage or cochlear damage or hair cell damage. And that includes people who have just hearing loss that came with time, or people who've developed hearing loss in response to some kind of traumatic sound exposure. And so what they are often told is, hey, your nerve is destroyed or it's damaged permanently. Your hair cells are damaged permanently. They don't grow back. Once your cochlea is damaged, that's it. That's what's generating your symptoms. That's why you're stuck with it. And I seem to recall you have some patient stories. I can think of at least one that you've told me from people who actually had pretty severe damage and were still able to recover or resolve tinnitus or hyperacusis. Can you share any of those stories?
Yeah. So I had one lady who had hearing loss so severe that she attended all her appointments with a BSL sign interpreter. And the tinnitus was so bad that it was affecting her memory, that she was completely disorientated. She was ringing her daughter saying, I don't really know what's going on, I'm a bit lost. When she'd just gone to the supermarket, she was getting very, very worried about this because it was affecting her sleep so much that she was just getting really disorientated as well. Brain, you know what brain fog's like. I mean, yeah. She can't use sound like other people can to distract from tinnitus and do the typical
asking sound apps, noisemakers.
Yeah, none of that was a thing for her. And
she had no hearing, essentially, on that side.
On either side, like both ears. Yeah.
Both.
Congenital hearing loss. Like.
Wow.
Really, really big, profound hearing loss, which is why even hearing aids weren't really, she could wear them, but she wouldn't really get much from them, and so she didn't really like them because, well, what's the point? They didn't help her communicate or anything. So, and she didn't want a cochlear implant because she was in the deaf community as well. But she was able to completely recover from it to the point, sleep came back, her life came back, the brain fog all cleared, and she couldn't believe it. But yeah, and she was saying, I can't hear it anymore as well.
Wow. Okay, so let me recap for anyone who missed this. So if you're out there and you've been told that your tinnitus or hyperacusis are incurable because you have some kind of damage to your nerve and to your hearing apparatus, this woman had very significant damage or lack of function, shall we say, to one or both of those components of her hearing system, and had tinnitus so loud that it was causing memory problems and disorientation, and she was able to recover from it fully. So think about what that implication is for you if you have less damage than she did. Yeah. Wow. Okay. Can I ask? This is a huge question, so I'm aware that this doesn't have a simple answer, but you're describing a parade of patients that you've worked with at the NHS and also clients you've worked with privately who've been able to make remarkable improvements. What are you doing with them? Like, what are you actually doing with these people?
I mean, the same stuff you do for dizziness, right?
Okay. I know the answer to this, yeah. but okay. I'm hoping some people listening to this are like, this is the first time I've been told that tinnitus is something I can actually recover from, or that hyperacusis is something I don't just have to manage for the rest of my life. What is this woman doing with people?
Okay, so there's the psychoeducation element of it, teaching people that these are the normal, healthy background sounds in the hearing system or head, and the brain is turning up the sensitivity and picking up on them and processing them as a danger signal. And there's this very famous study where people were put in the very quiet room for 5 minutes and asked them what they experienced, and 94% of them, when they came out, said they heard a ringing, buzzing, a tinnitus sound, essentially. And I think that
because tinnitus sounds are normal background noise.
Yes, but I feel the need to point out that my patients can't hear it in soundproof rooms once they've recovered, right? This was an anechoic chamber. This was a whole different level of quiet that they only do for research purposes. So this is, the walls are all weird, aren't they? And have you been in one? They're weird.
Like, the creak. You can feel like the creak of your bones, and you can hear like the gurgling of all these bodily processes you didn't know made sounds. Yeah, it's pretty eerie. Yes. Yeah.
yeah. So only audiologists really go in those, and they're just, and that's only at university. We do not have them at the hospital. They are just for the research purposes. But the point is that the research showed that these are normal, healthy sounds that are in everybody, but then are in normal environments and in normal circumstances, the brain just filters them out and you're not aware of them. And it's all in that situation. They think that the people's brains wasn't receiving as much sound information as it was expecting, to like abnormal, crazy, where's the sound levels. And so it started turning up the sensitivity to try hear, and then started picking up on the normal, healthy background sounds in the hearing system we had that were there all the time. So it's not that there's something broken. I mean, yes, maybe if someone's had loads of noise exposure, then there may be a change in the neural firing going on in their hearing system or head. But a lot of people completely adapt to that, and the brain just filters it out. And even if they have a noise-induced hearing loss, they don't hear the tinnitus sounds, or they don't have hyperacusis. So these symptoms are when the brain, tinnitus, when the brain turns up the sensitivity for whatever reason, often because it believes that you're in danger, so it's turning up the sensitivity of everything to try protect you, to try look for danger signals everywhere, and starts picking up on the normal, healthy background nerve activity in the hearing system or head, and then obviously the other sound sensitivities when the normal sound in the environment are being processed as a danger signal. So people's getting that understanding makes a huge difference. Them understanding that they can rewire their brain and teach it a different way, and teach it doesn't need to do this anymore, is really foundational. So there's the learning about it, there's the how they respond to the sound, changing how they respond to the sound, reinforcing to themselves, this is a safe sound, my brain's misinterpreting danger, but I'm safe, all of that kind of thing. But also teaching them, their brain, that they are safe in the world. And that can come from changing the way that they react to everyday stresses, changing the way they react to their emotions, so doing that emotional processing to get more safety in the nervous system. learning that their needs matter, which can take some processing.
It takes some work.
Yes, it can take some work, and just telling them that won't necessarily do that. They may need to dig deep to truly believe that. And that every time they have a normal, healthy emotion, that's safe. And so their nervous system doesn't have to go into high alert danger mode just because they've got a normal, healthy emotion coming up in their body. Anything you want to add to that?
I'm actually getting emotional listening to you talk about it. And I hope people listening are having the same reaction, because this is so far above and beyond what people are getting when they show up at their doctor's office and say, I can't stand this tinnitus. You've got to get this out of my head. People suffer so much. And also from the other sound related sensations we've talked about. And what you just described is so much more than most of these people ever get. And I'm feeling this swell of pride and hope for all the people listening. And then I also am aware some of the people listening may be hearing this and saying, oh my gosh, why did no one ever talk to me about this? Why did no one ever teach me this? I had no idea. I've been living with this. And now you're telling me there's something I can do about it. And some people get angry. And sometimes people will get angry at you and us, right? When they hear this, because it's just so hard to stomach the idea that there's something that can be done like this. And that there are things like what you talked about, like treating yourself better and feeling emotions and talking to yourself differently. It's stuff like that. It's not like taking supplements, spending thousands of dollars on supplements, or using all sorts of devices or whatever. It's simple stuff. It's simple stuff. It's not so simple to put into practice, I'm aware, but it's simple stuff. And that's what we're trying to teach people with the course.
And no side effects.
We want this information out there. What's that?
No side effects.
No side effects. Yeah, other than maybe being nicer to yourself. You may be less of a jerk to yourself in the end. So sorry about that. But other than that, no side effects. Oh, okay. So obviously we could unpack everything that you said and have an entire hour-long conversation on each component: the psychoeducation, the responses to sound, emotional processing, treating yourself differently, relating differently to stress. We go into some detail in the course. And I'm wondering if you could pick out, we've talked a lot about the psychoeducation. So I'm wondering if we could give someone a practical takeaway. So someone's listening, this is their first time being exposed to this idea that tinnitus and hyperacusis are things that actually you can recover from. What's the first thing that they can do today to start moving toward this recovery?
So different things are going to create safety in different people. But I think a really good first step is letting go of all these fear thoughts that automatically come up when the triggering sounds come up. Letting go of the stories that these thoughts can tell you and not necessarily believing them. And that doesn't mean we have to argue with them and give them a counter argument. And also getting more in touch with how they're feeling in their body, which for some people it's a completely alien concept, and I completely get that, and it used to be for me as well. And self-compassion. What's the kindest thing that they can do for themselves in that moment? And sometimes the kindest thing is to approach sound, to give their brain the opportunity to learn that it's safe. And sometimes the kindest thing is just to give themselves a break and have a rest.
I'm hearing is it's not about a specific tool that people need. It's that they have to try to figure out what turns the danger volume dial down in themselves. And for some people, it's education. I just need to understand this.
Yes.
And for other people, it's these thoughts. And for other people, it's feelings. And then for a lot of people, it's a combination of all of those things, and maybe also change habits and behavior. So I think the point that you're making here is you can start with one. All of these things contribute. So you can start with one and you're going to make a difference with it. Even if it's not the only thing you end up doing, you can start making a difference today, even by just challenging some of the thoughts you're having and some of the beliefs you have about what's possible for you.
Yes, absolutely. Absolutely. Anything else you wanted to add? Any first steps you would suggest?
Take the free course. We go into so much detail on it. And folks, we made it free because we think this information should just be out there for people. We know what you've been told. We know what you've been through. Pippa has personally been through vestibular migraine and understands what this can do to someone's life. I have worked with and talked to literally thousands of people with the area of specialty that I have, which is vestibular issues or chronic dizziness, chronic visual symptoms. So we are acutely aware of the amount of suffering that you've gone through, and also possibly the amount of money you've already spent to try to get rid of it or to help cope with it. So the course is completely free. We explain in detail everything that we talked about today and a lot more. We answer questions like, do you need sound generators? Do you need hearing aids? What does management versus cure mean? We talk about sleep. You mentioned sleep. We didn't go into sleep. We talk about emotions. We give you different ways of responding to sensations. We go through all of this in the free course. So if by the end of this conversation now you're saying, okay, this is worth a shot, then you should go take the free course. There's a link in the video description.
And if you're hooked on your sound apps and you're thinking, oh my God, is she going to say that I can't have my sound app anymore? Then there is a place for them, but with different framing. And we go through how and when to use these supports in the course as well.
That's right. Pippa, this was phenomenal. I am so grateful to you. I was hoping we could end on one more patient anecdote because you have so many amazing ones from the NHS and from your private clientele. Do you have any other hopeful patient or client stories that you could share, or one more that you could share before we close?
So I saw a musician and he had a lot of fear around playing in his band. So he was an amateur music. He went and played for free at gigs and he loved it and he had the time of his life and he really enjoyed it. And he'd stopped his main hobby because of tinnitus. And we actually did some deep trauma work together, and then combined with the I can do this, it's not dangerous, he gave himself permission to go play in his band, and not unsafe sound levels, I have to say, but he played in his band. And I saw him at follow-up and he's like, I didn't really need to come to this appointment, but I just needed you to know how amazing this is. I needed you to know. And then he said he got back from after playing in his band and he just lay in his lounge in silence and he was like, yes, I can do this. I've got my life back. Beautiful.
Beautiful. Thank you, Pippa. Again, I'm super excited to hear from those of you who do sign up for the course. There's a survey at the end of it. We would love to hear what your experience has been. Take your time going through it. It takes some time to get results from this kind of work. You did not develop tinnitus and end up with tinnitus for one day, so it's not going to get better in one day. It's going to take some work, but you can get there. So let us know. You can drop a comment or question below if you're listening to this on YouTube, or if you're listening to this as a podcast, you can, of course, join the conversation on YouTube. And We would greatly appreciate it if you could like, share the video, and subscribe to the channel or follow the podcast. These things really help us expand our reach. And it'll also let me know that you would like us to talk about sound-related symptoms more. So thank you so much for being here with us. And Pippa, thank you so much for everything. I'm just the luckiest person alive to have you as my friend and my colleague. Thank you so much.
Thank you. I feel exactly the same way about you. Thank you so much.
Bye, everyone.
Bye.